Hello, I'm Kristen Livingston. I'm a pediatric orthopedic surgeon at Boston Children's Hospital, and I'm the director of orthopedic trauma here. Thanks for the opportunity to do this Author Insights video. In my role at Boston Children's, I keep track of trauma quality metrics, including those tracked by U.S. News and World Report and the American College of Surgeons. One of these metrics is the time it takes to get pediatric femur fractures to the OR for definitive stabilization. It's an interesting metric because of all the controversy it stirred. Several studies have looked at clinical outcomes in femur fractures as a function of time to the OR, and since ultimate clinical outcome doesn't change much based on time to OR, that's led some people to argue that the metric should be abandoned. But the flip side of the coin is that not all quality can be measured in ultimate clinical outcomes. And a pediatric femur shaft fracture is a unique injury in that patients are relegated to bed rest. They can't be well splinted, they're often in traction, and with significant muscle spasms and pain prior to surgical stabilization. So many of us feel that getting a child with a femur fracture to the OR in a timely manner is very important, whether or not there's anything special about 18 hours exactly. It's a marker of an efficient trauma system that works well for patients. So while some have studied the impact of time to OR on clinical outcomes, there hasn't been research that we're aware of that looked at which patients were most at risk for delayed surgical care. So that's what motivated us to do this study, and that was the question we tried to answer. A lot of our findings made sense. So there are the logistical findings. We found that time of day of presentation is a huge factor in time to OR. When a child comes into the ED in the middle of the day, the child is an NPO, our schedule is already full of trauma cases for the day, the OR doesn't have the capacity for non-emergent cases at nighttime, and in the absence of real clinical urgency, it's hard to get surgeons to add on a 2 to 3 hour femur case at 7 p.m. So these cases get delayed until the following day. Whereas middle of the night admissions can be made NPO, and they're fit into the morning trauma schedule with little delay. We also found that younger kids who need spica casts wait less time, which means for good reason that we're prioritizing the toddlers to avoid a long NPO time and sliding in those fast spica casts before bigger cases, which is great, but we could really do better with our older trauma adolescent population who are waiting around in traction. Another important and concerning finding was that race affected time to the OR, and non-white racial groups waited longer for surgical stabilization. This wasn't explained by insurance status or need for interpreter, and this is something where we've really taken a deep dive into it with our Office of Health Equity and Inclusion, and we're still looking into pinpointing the bottlenecks that delay surgical care asymmetrically according to patient demographics. Another major finding that this research had was that the patients with comorbidities wait longer than healthy children to go to the OR. And this isn't terribly surprising, but it does create motivation to do a better job for our most at-risk patients. And this is sort of the parallel to the geriatric hip fracture cohort. We have a lot of patients with neuromuscular and cardiac disease who get femur fractures, and these patients may have unique considerations for safety during and after surgery. So our findings have spurred further research into whether these delays for patients with comorbidities were actually important and warranted, and to see if there are ways to make the path to the OR more efficient for complex patients. So this has been a really rewarding project. We learned so much, and we've used the information to improve time to OR for our patients, and we've been inspired to ask new questions that can continue to improve and streamline patient care. Thank you.